Thanks, Mary. Good morning. As folks heard yesterday, I am in Chicago for a meeting. Uh, and with Marissa is here, so it's been great to see her in person. And Kate Warren Barnes is here, and Chad Donchamont is here. So it's been great to be together. Um, we also, Marissa, Kate, and I tuned in last night and saw most of the hearing that happened. It was great to see so many 9:30 callers. When we joined, there were over 100 people kind of logged on. Many of you took time to share your public comment. I see Donna was there. It was great to Harold was there. Edna. So many family child cares. It was great to just see Eugenia ran a very measured hearing. So it was great to see folks. And remember, you still have time to write comments. So everything is due by Friday. So there's still time to weigh in. Really helpful to hear, people's experiences. So we would encourage you, if you need help, we have a ton of resources, which I sent the email out yesterday after our 9:30 call in the morning. And today we are going to switch gears. So we are here for our seasonal update with Dr. Angela Fowler from the Department of Massachusetts Public Health. And as you can imagine, there's a lot of questions about vaccines, about just health in general, about kind of what you're seeing. You always are so good to share with us kind of what you are seeing across Massachusetts and trends that we should be thinking of. So if you want to do a quick who you are and how you came to be in your role, and then we would love to hear an update. And then if folks have questions, you can add them in chat, send them directly to me. I have a few topics that people have emailed me already, which I will, and I'll monitor the chat, so you can not worry about that. So let's
Excellent.
move things over to you.
Great. Well, I'm happy to be back here this morning. My name is Angela Fowler, and I'm one of the medical directors from Department of Public Health, and I actually work in the Bureau of Infectious Disease and Laboratory Sciences. My main focus is vaccine preventable disease, preventing vaccine preventable diseases, and vaccine policy. Prior to coming to DPH in 2023, I was a practicing adult medicine physician. I'm an internist. I practiced at the Beth Israel Deaconess Medical Center as an adult primary care physician. Also in at MIT in college health. So have done a few things in the field, done some research and some teaching as well. So I'm very happy for each stage of my journey and happy to be with you today. I do have a few slides to kind of guide us, but really open to
Great.
kind of take questions as well.
Okay,
I'll
perfect.
start, with a few slides, and then we'll see where it takes us. I'm gonna share.
I have to share with you over the summer, some of our hot talks topics included whether Crocs were an appropriate summer shoe. That got everyone
Ah!
going. And then last week we somebody asked about nap time and children who don't nap. And so that I said if you thought Crocs was a hot topic, but we also know like these topics around children's health are also like people are having most interaction with parents. They have to
Mhm.
think about their own policies. So we're just so grateful that you're here today.
Oh,
Um,
absolutely, absolutely. Um, and let me try to get the little slides up, and then I'll try
yeah,
to.
this is the hardest part of the 9:30
I
call.
know
Yeah,
for
so
me,
it's for everybody it is. It's a very consistent theme.
you
And
guys see it.
yep, there you go. And just as a reminder, we're recording the call. We'll post it on our YouTube channel. And if you can send me the slides, we'll add them to our follow-up folder as well.
So I'll start out then, kind of addressing some of the things that you brought up. Summer shoes, Crocs. I know this is somewhat controversial. Um, I think I'll start off by saying I think it's always good for parents to talk with their own personal pediatricians about certain things like this. I think but I can kind of share my own personal opinion. I think there's some pros and cons with Crocs. I think some of the concerns that people have had is kind of, whether or not they're stable on slippery surfaces, kind
Right,
of
exactly.
slipping. So I would consider that, and then maybe consider the environment in which the kids will be staying. If it's going to be a wet area, if they're going to be going to pools or doing water play,
Right, that's
maybe it's
exactly what
not the
happened.
best
Right,
to. So I that would be my kind of quick take, but I think it's definitely worth thinking about, and maybe kind of consulting with kind of maybe talking to a few pediatricians about their
sure.
perception as well. So um and then what was the
Well,
next?
and you don't have so it was more about nap time and
Oh,
this
yeah, yeah, yeah.
this like if kids are sleeping too long, they don't sleep at night. Can teachers wake up kids if sticking to the schedule?
That's really an interesting question. And sleep is really something that's an important issue. And I think it's been increasingly recognized as an important issue for both
Yep,
children and adults. The policies, I think it probably changes, I guess, with the age of the children.
sure.
So it would kind of need to be individualized towards the age.
Right,
Um, and kind of if I would my personal thing would be, again, not being an expert in that area, is if there's a concern about a particular child sleep not sleeping or sleeping too much, kind of consulting
right.
with the parents and asking them to consult with their personal physician, I think would be a good plan as well.
Great. Thank you so much.
Yeah, no, no problem. But I was here, wanted to talk a little bit about respiratory virus season that's coming
Yep.
up. And so, I'm always very sad when summer is ending, but I talk to a lot of people who, fall is their favorite time of year. I guess weather is cooler. There are a lot of fun activities, so it's good. But I'm always a little sad. But so this time of year, we're kind of looking at change in weather, but we also start thinking about respiratory pathogen season or respiratory virus season. So this is a time of year, fall, winter. Is a time of year we see a lot of infections, respiratory infections. Starts kind of in later October, early November, and peaks at around January, February, and then kind of tapers off. The infections taper off March and to early April. Right now, we're not seeing a lot of respiratory infections right now. We do see a little bit
Mhm.
of bump of COVID, but it's on the whole, everything, there's not a lot of disease circulating. And why we see respiratory illnesses kind of spike in the colder weather, it's not entirely clear, but people think that this could be related to colder temperatures. Some of the germs and viruses that circulate at this time, they actually like colder temperatures. So the sunlight and the heat destroys the virus. And so you see more in colder weather. That's, in particular, flu likes colder weather. People are indoors more, and so they have the opportunity to kind of touch more surfaces and interact in a more enclosed space, which can promote transmission of infection. Students are in school, whereas they were out in the summer. Again, more contact, more opportunities for transmission, and also holidays, number of holidays that come up that offer opportunities to transmit infections. So um, there are a lot of respiratory pathogens. So when we see a bump in colds and flus over the season, fall and winter season, there are a number of different bugs that contribute to this pattern, but they're kind of the big three major hitters. And the major hitters that we track are flu, influenza, COVID, and RSV, which is respiratory syncytial virus. And a lot of times with these infections, you really can't tell them apart, like just by symptoms. A lot, they
Right.
all can look pretty similar. Um, and sometimes it doesn't really matter what it actually is. We can approach them as far as treatment in the similar way, but um, there are tests that can kind of determine flu from COVID from RSV. So those some of them are available over the counter, and some of them are available through clinicians. So, in most of the time, people experience these symptoms and colds and flus and get better, but these are important problems. And particularly, there are people and populations that are particularly vulnerable to these infections. And those include the very young, and also older people, kind of extremes of age, people who have chronic underlying conditions, and people who have immunocompromising conditions or are on medications that cause decrease in their immune system function. So I just wanted to point this out for people who are really interested. The Department of Public Health actually publishes data on how the things are circulating, what's circulating in Massachusetts. So
Mm.
this is our respiratory illness dashboard, and you can just look it up, and it's publicly available. And this is kind of the front page or the first page that you land on when you look it up, and it just shows you. You can see we track overall respiratory illnesses. So everything put all together, anybody who comes to an emergency room or is admitted to the hospital for a respiratory infection, we track that. We also track COVID infections. We track flu infections, and we track RSV infections. So if you're ever interested kind of in what's going on in Massachusetts, you can look here. You can also look by your own town or county. It's broken down. You can see geography. You can break it down that way. You can break it down by age. So there, and we also have vaccination data there too. So there's a lot of data is available, publicly available on this site if you're interested in it, and that can be a um, really good resource for people who like data and like tracking things. So yeah, so these infections, we expect them and kind of accept them to a certain extent, but they do have an impact on everybody, including early education programs. So we talked about how with kids, there's a high rate of spread in classrooms, and particularly very young children who really haven't mastered kind of personal space or hygiene. Um, and that has the impact of getting teachers and children sick and missing days. Families, as I'm sure everybody's aware, when a kid is sick, that impacts the whole family. Parents have to stay home or figure out alternative ways to manage their children. Um, outbreaks can disrupt educational programming and plans for the school year, and in fact, the illnesses for most children are fairly short lived, go away on their own. But for some children, as we talked about, in particular, there are people who have respiratory underlying conditions that make them predisposed to serious illness. Some of these illnesses can have serious impact. So we try to limit infection as much as possible, and vaccines are really our foundation for preventing respiratory illnesses during the respiratory illness season. And thankfully, we have vaccines for the big three hitters um, in causing respiratory illness. So flu vaccine that's been available for a long time. It's recommended yearly for everybody, children and adults above the age of 6 months of age. And so this is important protecting children, protecting staff. COVID-19 vaccines are available for children above the age of 6 months. Everybody above the age of 6 months available is important for children and staff. And for RSV is actually the leading cause of hospitalization for infants. Just a huge number of infants are hospitalized each year for RSV infection. But now, in the recent 2 years, we have very safe and effective protection for infants who are at highest risk. So we have the infant antibody that many infants will get at birth or at their clinician's office. And we also have another option where a pregnant person can be vaccinated against RSV, and that vaccination causes an immune response in the pregnant person, and the antibodies cross the placenta and actually protect the baby. So we have great options to protect people against these infections. But as we've been under. I'm trying to think of the right words. The word that pops in my head is attack, but maybe that's not the right word. But
Uncertainty?
yeah, there's been a lot of uncertainty. I think that's great. Thank you, Amy. And chaos around
Yeah, for sure.
vaccines.
Yeah,
Yeah, so vaccines, which for many years were so I'll say vaccines in as a big category are among the top public health innovations
right.
ever, in history, behind probably clean water, sanitation, food safety, potentially. Vaccines have really done a lot to help control disease and even eliminate certain diseases. So, again, very important public health tools. But recently, as there's been uh, increasing, I think, over several years, skepticism and hesitancy and misinformation and disinformation about vaccines, and I think it's even come to a head even more so that right now we have people in the federal administration that are not supportive of public health measures and vaccines and kind of have um, openly kind of expressed concern or hesitancy around vaccines. So that is a concern, and that I think is unprecedented. We usually don't have people, leaders in federal government, kind of working against what clinicians, public health professionals feel are critical tools. So we have this happening. You've probably heard, that the attorney, I'm not the attorney, the Surgeon General in Florida is partnering with the governor there and is trying to eliminate school requirements for vaccines, which is very alarming. That they would be the first state to do that, and
Right.
very, very, very concerning. So there, we have some headwinds as far as using these tools and promoting these tools, which are safe and effective. So just wanted to mention that. So I
There
would
is
say,
some support in the chat for attack is the right word. So
hey, okay, I didn't want to come on too strong.
didn't appreciate my diplomatic uncertainty, but yes.
Yes, yes,
I
yes.
do think there was a question about like traveling to Florida and
Mm-hmm,
because the families are going on vacation. So
mm-hmm.
there are a few questions coming in, but keep going. This is
Yeah,
great.
no, I would say, I mean, that has come into us at DPH,
Yeah,
talking about whether there should be travel advisories and things like
right.
that. I don't think that that's warranted just yet. I think
Okay.
that, um, we have to just be mindful of the places we travel. I think if we
Yeah.
are up to date with our vaccinations, we'll be protected. But
Okay.
I think it's really alarming. And I think I would be very alarmed if I was a resident of Florida.
Right.
But yeah, I think at this point there's no plans to
Okay.
do anything like that. But I think that against these kind of headwinds and the chaos and misinformation, I do think educators have a role. I don't think people should feel like though they have to kind of be a clinician or anything like that. But being there kind of to encourage families to seek out reliable sources and reliable information when they're making decisions about what to do with their families, talking with their, encouraging families to talk with their physicians, talk with their pediatricians, um, setting a culture of health, encouraging families to be vaccinated, and really encouraging that because that protects the entire community. Also, with staff also staying up to vaccinations. Again, protecting the entire community,
Yeah.
because as you probably noticed with most of the vaccines that we talked about, and we mentioned, well, I briefly mentioned maybe measles.
Hmm.
which there was a nationwide outbreak this year. All of those, are vaccine preventable diseases, but the vaccines aren't available to the youngest children. So, for example,
Mm.
measles, you first vaccinate children against measles beginning at age 1 year of age. So from birth to 1 year of age,
Mm.
children are unprotected. So that's a and with the vaccines we talked about with flu, you start vaccinating children at 6 months of age. So there's a period, and COVID as well. There's a period for young children where they're unprotected and they
Right.
rely on the community around them to be protected so that they have a kind of a bubble of protection around them. So
Mm.
it's really important for us to protect ourselves, but we know that when we're doing that, and for the children, but for everybody who can be vaccinated, to be vaccinated, because that also protects people who cannot be vaccinated for various
Yep.
reasons, including age. So I'll just move on. Um, we consider, immunizations a foundation of respiratory virus prevention, but it's not the only thing we encourage. Of course, hygiene, ventilation. I think a key thing that's important, is staying home when you're sick, encouraging families to keep their children at home when you're sick. And I know there's sometimes an urge to, people want to kind of continue with what they need to do, and
Right.
so staff should stay home when they're sick. And kids should stay home when they're sick. So we definitely want people to get vaccinated, but also focus on some of the other things you can also do to help prevent illnesses from circulating. I'll just point out some resources. You may be aware the CDC does have a portal for early educators, and it has a lot of information about a lot of different things, and including preventing infectious diseases in the classroom with some guidance there. So they have some useful tools there. Um, no, there's been chaos at the CDC. We don't know exactly what's
Mm.
going to happen there. They've historically been great partners and have great resources. But another place, if you want to point people to, is the American Academy of Pediatrics. They're the oldest, the most respected physician organization dedicated to children's health. And they run a kind of parent facing site called healthychildren.org. And so that there's, again, a lot of information about a lot of different things. Can be a very helpful resource, but they talk about immunizations, which, again, providing reliable information to
And we're going to
parents.
have the Massachusetts chapter president, Mioto, on the call in two
Oh,
weeks. So, yes,
oh, great. And
it's
she's
great.
excellent. We
Yeah.
work,
So,
yeah,
so love you. Thanks for that
love
resources.
her. Yes, yes, love her. And so, and then we were talking a little bit about measles. Measles is almost fully vaccine preventable. Knock on wood, we have not had any cases of measles. There was a nationwide outbreak this year with tons of cases, more cases than we've seen in 20 years. But we have not had a single case identified in Massachusetts. And we think that's because, well, it is because of our high rates of immunization. So we're thankful for that. We really want to push ahead and keep families, vaccinating their children to protect everybody. I just want to mention that, again, we haven't seen any cases, but there are resources on the CDC website to help educators and schools to prepare for measles should that be a concern or issue. So that's it. That's all I have. I'm happy to take questions, additional questions.
Thank you so much. And please, 9:30 callers, join me in the chat, and sharing thanks. There was a question. I'm not sure if there'll be a chance for questions at the end, but I'm wondering how other EEC licensed programs are informing families of various infectious diseases, like hand, foot, mouth disease, lice, flu, etc. And Shayla kind of added the link for kind of what you have to do, that you have to notify things. So maybe folks can share some of that in the chat. We shared the link for the dashboard. A question on Titus received a question. Many programs have noticed an increase in people taking religious exemption and would love to better understand the law, the science, the risk. And then questions about the measles spreads, and you just covered that. So anything about kind of the increase in religious exemption for vaccines?
Yeah, we've seen that, but it hasn't been as pronounced in Massachusetts as it has been in other states, to be honest. The other states have seen huge increases in religious exemptions. There has been legislation that has been proposed to try to eliminate the religious exemption. Connecticut has eliminated a religious exemption. That didn't pass in Massachusetts, but I think that's something that, potentially that can, people can regroup and try to pass that. But I think as yet, there have been certain areas in Massachusetts. Again, Massachusetts, we can talk about kind of just like we can talk about the US as a kind of a,
Yeah.
it doesn't really mean much unless we're talking about kind of a local area. Certain areas do have more religious exemptions than others. And I think we're working with communities and providers in those areas to try to, reach out respectfully and just make sure we're connected to communities and are available for support and questions. And then just along the lines about kind of how to respond to like an infectious disease outbreak, like hand, foot, and mouth disease, the local boards of health are often very, very helpful. So
Oh,
the local boards of health in your area, a lot of them are just on top of everything and can really be a great resource for everybody to help manage some of these things. So I
and
would
then
encourage, yeah,
Kate Warren
local board.
Barnes wonders, can you talk a little bit about the governor's recent move to sign an executive order that serves as a prescription for all Mass residents to get access to the COVID vaccine this year?
So that was actually a great thing, and I was actually at the press conference at
Oh,
the
great.
state house when they did that. So it is great because with all this confusion, there has been the usual mechanisms that authorize the COVID vaccine have not been in place
Okay.
through the federal
Yeah.
government. So what the state government, the governor and the commissioner did was kind of did a runaround. What usually happens at the federal level, we kind of did it at the state level. So that allows people to get COVID vaccine right now. Um, so we're very happy about that, and we're hoping to improve that as well. Right now, the way the kind of the guidance is set up is that right now, if you're 65 and older, you can just get a COVID vaccine. But if you're under 65 and you're trying to get it, you need to attest that you have a high risk condition that puts you at risk for severe COVID. And that can be almost anything, really.
Sure. Right.
Physical inactivity, you can kind of, so it's not meant to be, we're hoping that it's not something that turns people away. But
Yeah.
we're developing even more so that somebody could just walk in and just say they want a shot. So
Yeah.
hopefully that'll be coming in the next few weeks.
Tom Weber shares, oh, how I love and I'm inspired by a morning that starts with a thoughtful use of science to help make the lives of our children and families better. Thank you, Dr. Fowler and DPH. You rock. Kate Warren Barnes added, so grateful that we live in this state and have leaders like Dr. Goldstein and Dr. Farrell. And then Emmanuel said, you can get a COVID vaccine at CVS. I just checked. You just need to check off that you are eligible. So. We are so grateful and we'll look forward to your winter visit to hear what's brewing there. Really helpful to think about. And thank you for the dashboards. And then 9:30 callers, we'll continue this conversation. We have Dr. Robin Reisberg coming tomorrow from Boston Community Pediatrics. And then in 2 weeks, we have Marianne coming. So we'll have resource and people just keep the questions coming. It's always great that we have them ready to go for folks. So, Dr. Fowler, if you send me the slides, we'll have the recording on our YouTube channel. But we are just so grateful. And, you coming on the call really helps reassure us. And I loved how you called out the role of for educators. Because I think, we hear all the time like how trusted early educators are. And so they always want to make sure they have the right information and kind of can connect with families.
Absolutely. Thank you. Thank you so much. Always happy to be here.
Great. So we'll see you in the winter and 9:30 callers. So we'll have Dr. Robin Reisberg tomorrow morning. And then Danielle Ewing is coming on Thursday for an update at the federal level. So we will see you then. Thanks so much for joining us. Have a good day.